a new show called Body Talk, where we will approach subjects having to do with health and wellness. With me, I'm just hearing some stuff over here in the audio section I'm not used to, but anyway. With me is Marlene Childers, registered RN that works at the college here, Director of Health Services. And the first subject that we're going to have is measles and immunizations. Seems to be a hot topic nowadays.
It is. Actually, just in the past 3 months probably, we've had a major widespread of measles across the United States. And so I felt it necessary to touch on this. It is a problem here on campus because nobody has actually come down with the measles or been diagnosed with them, but we have a lot of students who actually don't even know if they've been immunized for the measles. So it presents a real problem.
When did that become not necessarily mandatory? Or I think when I was growing up, everybody had to do it, right?
Yes. As far as you mean providing proof that they've been immunized or
Yeah.
just...
Well, didn't you have to bring your child to get immunizations?
That's correct. When they started school, it was mandatory, but now things have changed, and so because of that, they are allowed to decline that vaccine. It is not a mandated state law in Ohio. It's just mandated that they are given proof or provide proof that they've not had it and for the reason why. And that typically can be religious or personal reasons why they don't get vaccinated. So it presents a problem because...
Now, is that the only vaccine you could opt out of?
No,
or is it all of them?
No, actually, you are able to opt out of all vaccines. Typically, again, due to religious or personal reasons. And with me here, I have Jennifer Truance, which is she also is a registered nurse, and she's in the bachelor's program here at the University of Rio. And so she has done some gathered information and researched about immunizations and...
Which, as a nurse in the area, it seems like more people are opting out of immunizations. Really? It seems like they're saying that, oh, it causes autism, or I don't want my kid to have it, or just a liberal choice.
What's both of your professional opinions about if it has anything to do with autism? I kind of point at something else, personally.
There's been studies.
Yeah.
There's been no proof, just been studies and theories and people's personal opinion. But I think the one we're focusing on is measles because of Ohio having measles outbreaks, and Ohio, Miami College, Ohio University. So it's just not big colleges in California or Texas or Florida. It is right here close to home. And I think measles is a virus, and it'll cause rashes, cough, runny nose, eye irritation, fever. It can lead to pneumonia, seizures, brain damage, and even death. They, especially with the college, you got the close living quarters, you know, the dorms, the dining halls, the study areas, the common areas.
And I think the worst place on campus is a computer lab. You know, as gross as it may sound, people are typing and they're wiping their nose and they're typing and they're wiping whatever. They've been to the bathroom and they're touching the keyboard, and then you come in. That's to me, the worst place to pick up something. I
agree. Just like at home, your remote control is like the worst thing you can touch.
Or in a hotel.
If you're traveling, yes, in a hotel setting, absolutely.
And with measles being extremely contagious, it can be spread through tiny droplets that spray into the air when somebody coughs, sneezes. So you can imagine, like you said, wiping your nose or coughing or sneezing and then touching the keyboard or the bathrooms, or, you know, how fast it could spread.
How long does it take to show up if you were to contact it?
Well, first off, Mike, it can actually live on a surface for 4 hours.
Okay.
So in other words, if you were to cough or, just wipe your nose and then touch that, that virus can live on that surface for 4 hours. So that's why measles is so highly contagious, because it's not like, anything else where, you wipe your nose and then touch a surface, and after a few minutes it typically dies, but it doesn't stay on there for 4 hours. So I'm sorry, to get back to your question.
Maybe I'm not following along your format, but
You have to tell me your question again. I'm sorry.
okay. I sat down at a computer, contacted with my hands, I touched my face. I've contracted
Okay.
the virus. How long till I know that I have it?
It could be 7 to 18 days before I actually become sick.
Huh. Well, that's quite a time. And then
And 3
how
to 5
fast-
days before I would maybe even get a runny nose or anything.
Really?
But before I get full-blown sick, it'd be 7 to 18 days and 3 to 5 days before any symptoms could show up.
And
So
then-
you may, in 3 to 5 days, you may not know where you've been to contract it.
Right. Well, by that time, it doesn't really matter. But then, how long does it? Measles has bumps, little rash or something, right?
That's correct.
How long does that take to show up? By that time now, I'm thinking, do I go to the ER?
It can start showing up 4 days after you've been, exposed to measles. So,
So they give the range of 3 to 5 days that
Okay.
symptoms could appear. And you'll first notice maybe a little fever, your runny nose, extremely runny nose, red eyes, runny cough. So basically kind of
So-
like your common cold.
Right. I could just have the usual thing of the spring, hay fever or something.
correct. That's correct.
And not thinking anything of it, and
Right.
kissing the wife and the kids and everything else.
And which a more significant thing, a few days after your first symptoms, so after the 3 to 5 days, you can develop a rash in your mouth, along your cheek lines and stuff like that.
Sore throat.
Now, is this rash something like chicken pox? Is it itchy? Does it burn? Is there any other?
I would
feeling?
imagine any rash is itchy.
It is itchy, yes. You're very inflamed with it. In other words, when you develop that rash, there's a lot of erythema, which is redness, and so it just looks like huge hives all over your body.
Kind of patchy or head to
Yes,
toe? Patchy.
it normally starts on the face and works its way down.
Okay.
And so then when the rash starts going away, it works the same way. So it will start going away on the head, the face.
Where you've had it the longest.
Right. And I remember as a child, at the time, I'm going to kind of tell how old I am, but when I was born, there was no vaccine.
Oh, really?
So this vaccine came out in the 1960s. So
Okay.
yes, I said it. But so that vaccine did not exist. And so I actually developed the measles, and I remember how sick I was.
So you had the measles at one
I
point?
did. And I actually, and here I go again, telling on myself, but I actually used to be a thumb sucker, and so I had measles on my thumb, got it in my mouth, and I was a mess. I was very sick with it, so it can leave you very sick. And the older you get,
How do
if
they
you're-
treat it?
Well,
Since it's a virus.
there's really no treatment. You're just treating the symptoms. So
Because at worst, you can die from it.
absolutely.
And if there's no
'cause,
real treatment, then, is it the symptoms that you die from?
No, it's the secondary effects of the measles, which can cause you to go into pneumonia, like
Okay.
Jennifer had said earlier. That one of the complications is pneumonia,
It can even cause swelling of the brain.
encephalitis. So it's a serious, very serious disease, and so we got to make sure that we share the information about the vaccine. And of interest, too, is I would imagine up in Athens, that's one area where a lot of parents do not vaccinate their children. So I'm kind of maybe anticipating that if this USA widespread measles epidemic continues across the United States, I would be concerned about Athens and OU having, high numbers of measles cases.
Now, is it more prevalent during the wintertime, or does it run year-round?
It doesn't discriminate.
Okay.
Nothing.
So
It doesn't discriminate.
any
nothing.
time of year, could have it. I've been vaccinated, so that was one of those times in the mid '60s where
they had the shot out by that time for you.
That's not the one that made the little dimple on your arm, did it?
I think that would have been the chicken pox, not the chicken pox, but the diphtheria and tetanus.
Yeah, that never took on me. I did it twice. I never got the little thingy in my arm or whatever, but I had all the immunizations. I had to prove when I went into the military, when I went to the first grade, had to prove all, shot records. But I guess going to school nowadays, you don't have to have a shot record?
Well, that brings us to a whole nother topic there.
You're supposed to, but I think you can be excused from it due to religion or personal beliefs. But I think measles is highly preventable, and the vaccination's very effective.
It has been through the past several decades.
Absolutely.
It's been proven that, we never really had any outbreaks until
People quit getting the immunization.
Right.
And so we'll talk a little bit here about that vaccination.
Who should get immunized?
And I know with a lot of different things, it's sometimes more dangerous for older people to do things. Certain shots or procedures, like getting your, your wisdom teeth out or different things. Is it more dangerous for an older person which an older person now shouldn't need it because they probably were immunized as a child?
Immunized or have had it.
I think for the elderly individuals that most likely they have had measles. However, if they haven't, they recommend that they get
Like a booster
2
or
doses,
something?
yes.
Now,
of the vaccine.
Is the regular vaccine a multi-dose thing? Or is it just a one-shot?
No, it's a one-time injection, but if let's say you're a student, you had it as a child, they recommend a booster prior to going into college or at least in adolescence, because they get that first MMR around 15 months of age. And then after that, they do recommend that second booster.
I personally think it's the responsible thing to do for you, your family, and everyone around you.
Absolutely. I
I'm
mean,
not sure
I'm sorry, but if you can do something to prevent yourself from, getting sick or your child from getting sick, to me, I would take those steps to prevent that. And this vaccine does that.
And just as a responsible person, we were just discussing earlier, me in general, I'm a student here. So if I sit beside her and she gives it to me, I'm going to Huntington, West Virginia to work. I'm going to Charleston, West Virginia to work. I'm coming here to school.
And you're going to a hospital being a nurse,
yes,
which is a
and
great
look
place
how
to
many,
be.
and then going home to my family and my kid going to a local school, me just being one person, I could affect the whole tri-state area. And that puts a lot of risk. So I think responsibility for yourself and others would be an important thing instead of opting out to be liberal or whatever religious beliefs. That's a different issue, but I think a lot of people aren't getting them just because it's the trend.
One thing I don't know, maybe it's just my personal idea that I think some of these autism. How about the amount of ultrasounds that people get during pregnancy? We didn't
have
used
to
to do
wonder.
that.
Absolutely.
And now it's almost commonplace to do it every time you go in to see your doctor. To me, if I did the first one, it looks okay. Let's wait till they're ready to come.
And then a lot of people, a
And-
gender, a 4D.
Right.
There's, shops
Right.
for that just to get extra ultrasounds besides what your doctor gives.
Yeah, I think that's dangerous. It's still radiation, I know it's a different
agree.
frequency,
Yes.
but it's still radiation of some sort. And that to me scares me more than any of these
Shots.
shots.
There are,
So where, if you were looking to get a shot, where would you go to get one?
well, again, what they're saying is generally anyone 18 years of age or older who was born after 1956 should get at least one dose of the MMR vaccine, unless they have either been vaccinated or had measles. Okay, so there are certain reactions that occur with the immunization. A mild reaction would be fever, a mild rash, swelling of the glands right here in the neck.
So is this like the flu vaccine where it's a dead virus or something that they give you?
This is an inactivated
Okay.
injection.
So it's similar to
A
that.
dead virus, yeah.
Yeah. So
I'm not a
it's-
nurse or a
yeah.
health professional.
Yeah, I'm sorry about that, but yes, it is not an active virus.
Okay.
It's inactive.
So you're not getting one of those things that you got to worry about. Oh no, I'm going to
No.
be real sick.
And so usually moderate side effects or reactions from that would be seizures. And a lot of times I think that's where parents may shy away from a vaccine. But the seizures can be caused by a fever. So all a parent would need to do for that would be to medicate
Right.
for that
Tylenol
fever.
or whatever,
Right.
bring the fever down.
Some temporary pain and stiffness in the joints, and then a low platelet count. But they don't see that too often. I mean, they're not going to draw platelets unless you go in and you're very sick. That's part of a complete blood count. So they wouldn't just be drawing blood to check for a platelet count. And then less than 1 out of a million would have a severe reaction, a serious allergic reaction, which can cause permanent brain damage. But
So I have probably a better luck winning a couple $1,000s on the lottery than I would
than
having
you would
any-
having, exactly, yes. And so if you are pregnant, though, you should not get that MMR vaccine. So you would need to wait until you have delivered your baby, and then about 4 weeks later you can get
Or maybe
vaccinated.
I would do it the same time my kid got vaccinated, just both.
Yes. But and then anyone who's being treated for cancer or HIV, AIDS, or has recently had a blood transfusion that has a weakened immune system, they recommend not getting that vaccine. So I'll let you tell where you can.
And where
get
do you
it.
go to get this vaccination? You can go to your primary care physician. Majority of healthcare providers, health clinics, quick clinics will offer it to you. Some of your local schools will offer it to you. And the Gallia County Health Department, located on Jackson Pike here in Galplus, they are open Monday through Friday, 8 to 4. They offer it. And the cost of it. A lot of people don't have insurance, or maybe sometimes your insurance won't cover. If you are 1 to 18 years of age, it is free through the health clinic, no matter what your income is, anything like that. If you do have to pay out of pocket, it is $82.16, and that is at the Gallia County Health Department. And if you don't have insurance or your insurance won't cover, they do have programs for it to be free. Sometimes it's income-based, other times there may be other qualifying factors, but you could just go down there and they'll determine. So don't not get it because of cost.
And so with that in mind, I'll put this out. If you are listening to this and it's been a while since you've had your MMR shot, and that could be since you were a baby or perhaps a toddler or whatever, you need to get that second dose. You need that booster.
Are you talking to me?
I'm talking to everybody that may be listening.
Okay, because I had it when I had the immunization when I was a kid.
So then you might want to go ahead and get a booster because it's been a while. I mean, that's what they're recommending.
Okay.
So if you've not had the measles, you've just had one shot, you don't have any chronic health illness that weakens your immune system, again, which would be cancer, HIV, AIDS, hepatitis, that type of thing, then yes, it is recommended that you get a booster.
Okay.
So think about that. And again, like just to highlight what Jennifer said, if you are 18 or under, you fall under that Ohio free vaccination for children program. And so that's where any child below the age of 18, again, gets free vaccinations. And then, like she said, again, go to the local health department here. And all health departments are different, but here it is $82.16. So
And as a college student, that's a lot.
Yeah.
So I think there is assistance available for it.
Okay.
So all they would need to do would be go to the health department. They don't have income, no job, they're a college student.
Right.
They have grant money that may be available there to help these
Okay.
young adults with this. So
All right. So right now it is the beginning of March, and it is becoming spring break time. Now, you were ending on, I don't know if I can afford 80 some bucks for immunization. Somehow they come up with the money to go on spring break.
yes, they do. With spring break, it's time to head to warmer weather. And
I'm all about that right now.
Absolutely. What we've got, like they're saying, 6 to 10 inches of snow coming
Right,
heading
tonight.
our way tonight. So yeah, I'm all about heading south to for warmer weather here. I'm kind of tired of this winter stuff, but
Okay, so we've got some tips for you to have a safe and sound spring break.
yes, being campus nurse here at the university, I feel that I kind of needed to highlight a few things. So keep in mind when you're going on spring break, you need to stop, think, and act. What does that mean? Well, bad things can happen. You can go out and have a good time, but again, bad things happen.
That's where I see a lot of young people don't necessarily have that thought process. I did when I was younger. I would see somebody doing something cool, or think of something I could do that seemed really cool to do. But then I would stop and think, what if something goes wrong? This and this and this could happen. So maybe I may not do that. But a lot of this generation seems like that sounds cool. So
Let's go for it. Let's do it.
Let's do it. I'm extreme.
And especially, perhaps if they're drinking, with drinking alcohol comes sometimes bad choices, especially when, they drink too much. So, you need to think before, you need to stop, think, and act before you try new things. And so you got to think about what can happen. And so remember, for every action, there is a reaction. And so just think before you react to peer pressure, react to becoming inebriated, going out dancing, whatever. You need to have a game plan in place. And so before you go out with your friends, let's say you're going out clubbing, you're going to dance, you're going to drink, you need to get a plan in place. And that plan should be,
And that's more than just what I'm wearing.
Absolutely, absolutely. So, get a game plan in mind,
Buddy system.
Absolutely. Like,
Right.
am I going to drink, or who's going to be our DD? Who's going to be our designated driver? And, a
And
lot
make
of
sure
times,
you pick a responsible one, because I've seen other ones like, oh, I'll have a couple, and then by the time we
Yeah.
go home,
yeah,
I'll
and
be
they're not
okay.
in much better shape than
Right.
what you may be. But so,
and you got to protect your drink. If you want
Absolutely,
to protect
Mike.
yourself from a sexual assault or whatever, doing dumb things,
right.
don't leave your drink out. I guess some
So-
people put kosher on, keep them with you.
Or at
It's just like
least-
leaving your car unlocked in the parking lot with your laptop in the back.
Yeah.
It's your responsibility
Right.
to keep your car locked, and then bad things won't happen.
That's right, and that's pretty much, you're right. You're exactly right. That's how it works on spring break. If you go out with friends, you need to go home with the friends that you came with.
Yeah.
So don't allow your friend, or friends to go with somebody, some stranger.
And don't ditch your friend, even though they may be
Oh, I know,
obnoxious.
right.
Don't ditch your friend.
Yeah, you gotta look out for one another. You're friends, and so you gotta take care of yourself and who's with you. I mean, you gotta have their back. That's the bottom line.
Okay, a lot of things somebody might say. How do I've drank too much. How would I avoid having a hangover?
Well,
To me, your thing says that there's no real prevention for a hangover. To me, be hydrated.
absolutely.
Alcohol dehydrates your brain and your circulatory system. If you're going to drink a couple shots, have a glass of water or have one with you, and have a couple more shots or whatever. Have some more water, and that, to me,
That
is
helps.
the best thing.
That absolutely
That way you
helps.
won't get the hangover, and then you don't have to look for that cure, which is who knows, sausage and eggs or whatever you want to eat that next morning.
Spam or corned beef hash or potted meat. But
That
White
sounds great.
Castle,
Oh gosh, that wouldn't do me if I was straight.
I hear you. I've been there and done that, I think.
Yeah.
Rest
What
of
other-
fluids.
Not proud of that, but
What other subjects do we have?
Safe sex tips.
Oh, safe
yes,
sex.
and so you gotta think about what you're doing here. I mean, because the decision you make while you're inebriated or you're buzzed can affect you the rest of your life.
Right.
If you don't protect yourself, you could end up with HIV,
Yeah. Like Eddie Murphy
hepatitis.
used to say, HIV or what is it? What's the other one?
AIDS-related complex or
Uh,
hepatitis.
herpes.
Okay,
You keep that
herpes,
stuff
yeah.
like luggage. It never goes away. So
Well,
once you
and
once you
that's right.
contract it, you just don't go get a shot and it goes away.
Right.
That's yours to keep.
Mm-hmm.
So you got to watch what you're doing.
I mean, you just need to be aware of your surroundings and,
Use protection.
exactly.
Condoms and
watch
whatever.
your drink. I mean, it's very important. And if you want to get up and dance, make sure that somebody that you're with is watching your drink.
Right.
And don't take a lot of valuables with you. But
Well,
go
we're
out
ending.
and have a good time and enjoy yourself and be safe.
Right.
And remember, always buckle up too. That's real important.
Right. Okay. Well, thanks for watching the first episode of Body Talk. I'm not sure what we will be talking about next time. This happens every month on this week. So let's see, this is the first week. So the next first week of the month, we will be back with Body Talk. So join us then. Thanks for watching.
Thank you. Thank you, Mike, for having me. And Jennifer, thank you so much.
Stay classy, Rio Grande.
And keep safe. Okay.
That wasn't that bad, was it?